Plantar fasciitis is a condition that affects the lower extremity, primarily the foot, but it can affect the toes and up the leg here. One of the things that we'll see with plantar fasciitis is pain right here at the heel where the tendon becomes very dense and thick, and it'll refer down into the toes sometimes. Another couple of things that complicate this are bunions. When we see a bunion here on the great toe and it makes the toe deviate that way, it puts a lot of stress on this plantar fascia at the attachment. Plantar fasciitis is it's an injury or condition that can happen from a trauma, but it's usually a wear and tear. We'll see this in folks who spend a lot of time walking around in their manufacturing or distribution facilities with poor footwear. They have to wear steel toe shoes, but at the same time there isn't a lot of room for the foot and the toes to move in there. I mentioned the bunion, that's a big player also with plantar fascia, as well as just ankle mobility. If we lose the mobility in the joint up here, we have to make up for it elsewhere. So we'll start to really stress this area down here on the bottom. A couple of the ways we can successfully manage this at Chanhassen Chiropractic is through myofascial manipulation techniques. So using manual therapy to get in here and find where that tissue is bound up, where it hurts, where it's not moving, looking all around the ankle and the foot. So we'll get in here and mobilize this soft tissue. Treatment can be uncomfortable, but so is the condition. So the soreness is usually short-lived and the results are likely to stay around a while. Another way that we can treat this condition is with shockwave therapy. So shockwave therapy introduces shockwaves into this congested or painful tissue to help the healing process. So it reduces the pain by bringing in new blood flow, cleaning up some of that stagnant tissue that hasn't had any blood flow or perfusion to this area for a while, and that starts the healing process. So using the shockwave in conjunction with myofascial manipulation are two ways that this can really help speed up this chronic injury known as plantar fasciitis.